really, really well. They're local, they're well used, everyone knows them. They're sited where they live. There's not many people have to travel a long distance to get to them. If they're struggling to get a GP or a nurse appointment, they can use these services. The transport situation has been addressed on several occasions already. There's no two ways about it. If you're elderly or you're less mobile and you haven't got a car, which is a great portion of the world, you are going to struggle to get to a centralised urgent treatment centre without a car. Just to pick up on the thing about a bus, by the way, if you've got a cut hand and you're on your way to Alabama to get it stitched, you can't get in the bus because there's a Bible says you can't get in the bus if you're bleeding. If you call a taxi driver is more likely going to say, no, you're bleeding, get out of my car, or yes, you can get in, but we'll charge you £50 for a clean up for afterwards. So all people are going to do is use ambulances as a taxi service. We were talking about Spain on the ambulance service. The health inequality that's built into this is just unbelievable. You're centralising everything on the west of the world, whether you like it or not, that's what's happening. And we've got so many people on the eastern side of the world in deprivation places that just it's frightening. We have a situation where we keep talking about they're going to replace the existing position, the existing provision across the world. The existing provision actually works quite well. 8,000 people used it last year. It seems to be working quite well. Why replace something? If it ain't broke, don't fix it. But if it is suffering a little bit, help it, improve it, modify it, change it. Don't scrap it because you can't, just because you can't. The Million Minor Injuries Group and the Wirral Water Census Group and the Federation Patient Group have all got together to produce this. As I say, there's 11,000 signatures already on position. There's more coming in every day. Do not the health service, defend our health service. Other groups are signing up with us all the time. 99% of the responses, 99% of the responses we've had have been that they disagree with these proposals and want to see the existing services retained and improved. The public awareness of this through social media is growing policy. It's on Facebook, it's on social media, on Twitter, we've been in the local press, we've been on local television services. The GP Federation Group represents 25 to 51 GPs in the world. Again, Abby will come up with some figures later on to show you what the clinicians think of this. Again, to re-emphasise something we said before, we don't believe that there's any need to do this. We won't object. If they want to build an urgent treatment centre at Alabama, knock yourselves out. The more provision for health services you provide to our patients and the people of the will, the better. But don't do it at the cost of existing provision, which is well used, well liked, and it's local. It's where people are and it's where people access. Thank you.
Thank you. Right. Mrs. Hodgson, did you want to say anything yourself before?
I can't add anything to the facts. My name's Betty Hodgson. I'm chairman of the. My name's Betty Hodgson. I'm chairman of the World GP Federation Patient Group, which represents the PPGs from 25 practices. And I can't add anything to the facts that will be given to you. I've just come here to add our support and to say that the Federation's, the way we're working and the opposition to this has unequivocal support from the patient group. I've been working with patient groups and working with the CCG, sometimes for, sometimes against. I have never in all my years known such feeling that is coming from the general public about this. These places are needed where the people are, not at Arrow Park Hospital.
Thank you, Betty. Chair, thank you. I think it starts with Allan's last slide about patients being confused, and you can see that is the front entrance of the Miriam Medical Centre Burgess-Joyce building at 10 o'clock in the morning when patients are waiting for the minor. They are not confused about it. People know exactly where to go to access services. Now, I want to talk about some figures because I think it is surreal listening to some of the figures that have been presented. I know that the AD department is missing targets, etc. But what people don't know here is that Wirral's A&E activity has increased by 4% over the last 4 years, as against a 27% nationally. So why is Wirral bucked the trend? The Wirral has bucked the trend because we have very effective minor injury services and walk-in centres that are absorbing quite a lot of the patients who would have otherwise gone to A&E, and that's what people are doing up and down the country. And the arrow path will show you in the next slide. You will see this very interesting figure, which the CCG has unfortunately not highlighted. If you look at the attendances at Arrow Park A&E, when minor injuries and walk-in centres are open, the number of attendants go below the national average. And as soon as those services are closed, the figures go above the national average. And one of the last points I want to make here is that I know that A&E figures are not great, but they are improving in the last 6-8 months. Do you know, one of the things that our staff do from all the minor injuries and walk-in centres at the end of the day is that we give our figures, because 100% of our patients are seen within 60 to 90 minutes. Those numbers are added to Arrow Park's A&E attendance before publishing the target figures. I think the people of Wirral, the council, the councillors and others need to know that we are contributing to that. So if that A&E performance is improving, it's because the patients that are my staff, the number of them who are here, who are seeing, that is added to that. That is not publicized very much. This is the slide I was talking about, where you will see that as soon as the minor injury and walk-in centres are open, the waiting times, the attendance rates goes below the national average. Okay, where are these centres? These are centres, this is not the greatest slide to see on the screen, but they are generally based in the population centres. I agree that West Wirral doesn't have one, and I do believe that there should be one in West Wirral. That doesn't necessarily mean that you strip off services which are in the population centre. If you look at the next slide, the deprivation index, and if you actually chart out the deprived people in this country by their own public health figures, 65 to 70% of the people live on the east side. So it is natural that the services are going to be based there. And if it is missing in some area, I think we ought to be putting one new service there, not taking it out from other areas. Now, we need to be careful. What have these minor injuries and walk-in centres done? They have seen 100% of their patients within 60 to 120 minutes, contributing to Wirral's performance. Patients are being diverted from 111, Arrow Park A&E to reduce the demand. And we take them, we absorb them. It is managing the GP manpower crisis. One of the reasons we don't have a crisis in Wirral is because we have good services. And when patients can't get GP or nurse appointments, they get seen, walk in, and they get seen in these clinics. So that is helping the situation. So I am very proud of the fact, I wouldn't call the fact that my practice is a provider of the services a conflict of interest. I'm actually very proud of the fact that we're doing it. It is a service that is open 365 days a year. It is open even Christmas Day, New Year's Day, every single day, and it was rated as outstanding by the CQC. So we are very, very proud of that, and we see over 25,000. I'm struggling with this. Okay, sorry. Value for money. I think it is important. Allan mentioned about the fact that information was not provided. Because I think Wirral people need to know that, for example, minor injury services are being provided at a pro rata cost per attendance at somewhere between 15 to 20 pounds. The same problem, when they go to a walk-in centre, it escalates to 50 to 60 pounds at times. And then when they go to A&E, it costs 80 to 100 pounds. Now, I want to know by which mathematical analysis it is a better value for money for these patients to go from the most cost-effective services, most efficient services with the best outcomes, which I will demonstrate, to a different place. Don't think there has been a financial impact analysis of what these changes are being done. The urgent treatment centre, personally, we don't have a problem with an urgent treatment centre being set up at Irene Park, and I'll come back to that later. But I think one of the things that the CCG have not done is given detailed analysis about what the activity is going to be, etc., and what is the financial analysis. We are getting some of that information now, 2 months into the consultation, because we asked for that under the Freedom of Information. I would have thought that as public representatives, you should have known that. I think the public of Wirral, if they are being asked to make a fundamental change, they ought to have known that. And I think the driver for this initiative is simply to meet an NHS mandate, because the hospital is a failing and it's on the marker. It is also because the CCG in the marker. We understand that we don't want to be in a difficult situation. We may need to have an urgent treatment centre. But if you design an urgent treatment centre in the manner that this proposal does, it is going to create significantly poor outcomes for the people of Wirral. And I've been a GP for 32 years in the north end of Burgess, and I would like to see that our patients suffer because of some mandate and an arbitrary way of redesigning services. The urgent treatment centre, people are now saying, the CCG's claim is that I've seen this, even you might have seen this on television, the buildings are safe, all these things are safe. There's also a certain comment being made, which I never thought. They are saying that this is going to be safe because it's going to be delivered in NHS premises. Let me assure you one thing. All these services are being provided from NHS premises. If they think that particularly a building like Burton Medical Building is a PFI, so is a VCH. Every one of them, VCH is 100% PFI. St. Catherine is 50%. So I think this whole notion being thrown into to say that these are NHS, but all of us provide services from NHS premises, funded, rented through NHS. We don't own them. And the other thing to understand is that people are saying, oh, don't worry about it. Your phlebotomy service is going to be safe. Physiotherapy service is going to be safe. That is a misleading information, because those services have got nothing to do with minor injury or walk-in centres. So to say that those services are going to be safe is an inaccurate information, and it is a shame